I'd like to welcome everyone back from the earlier discussion. A lot of food for thought, a lot of discussing things, a lot of interest in things simple as scale and the targeting of data and the like. Just altogether, just basically a very good setup for the panel to come. We have one more session speaker. That would be Nick Ogden. I would ask him to come up and start, and then ask all the panel members when Nick is done to please take their seats up here, and we'll start this panel session. Thank you.
Thank you. Thanks for inviting me to speak today. I'm going to talk about climate change and vector-borne diseases. Just give you a bit of introduction first of all. Talk about the biology and a little bit about the touch on the socioeconomics. Then I'll just describe what we've, give you a run through mathematical and simulation models, different modeling approaches, the pattern matching models, a couple of examples, and then a bit of a wrap up. So climate change and vector-borne disease. Of course, from a public health point of view, we're interested in climate change because of the fear or the concern that it will cause emergence and re-emergence. And just for to kind of clarify what we mean by this, I usually start these kind of talks talking about ways that these diseases can emerge. Assuming that they emerge we have the capacity to detect them, and certainly there's an element of emergence of capacity to do that in many emerging infectious diseases. There are really four ways that diseases can emerge or re-emerge. The first is that there is that a pathogen or a vector arrives by plane or boat from an exotic location and sets up transmission cycles because the conditions are suitable, and that's what happened with West Nile in North America. Geographic spread from one endemic area into another, which is what's happening with in Canada with Lyme. George, thank you. And the next is what I term re-emergence, which is that we've got an endemic vector-borne disease or disease of some sort, and environmental ecological change, driven perhaps by climate change, makes the pathogen easier to or more abundant in the environment, more transmission, or if it's a zoonosis, more capable of spilling over from animals to people. And as I say, I call that re-emergence. And the last one is what I call true emergence, which is the evolution and fixation of a novel pathogen. The number of ways you can kind of slice and dice vector-borne diseases. Certainly, two important categories are: some are human to vector to human transmitted only, and some are animal to vector to human transmitted by accident, usually humans not taking part in the transmission, and those are the vector-borne zoonoses. There's a very diverse range of vector-borne diseases. We tend to concentrate on fly-borne, tick-borne. There are others not necessarily well studied in terms of climate change, so on. But certainly there has been a lot of work done on plague here in the US. Climate is only one driver amongst many, as we've been talking about. Habitat change, hydrology changes, land use, agriculture changes, and of course the more sort of human, social, socio-economic aspects of urbanization, globalization, and so on. What is the information we need from modeling? We generally need to know where, and we need to know when, and that's the understanding the environmental risk, as we've talked about before. And again, similarly for the other pathogen, the other health issues, the actual health outcomes, calculating that is something we can obtain from knowing when and where, but it's something that is more not so easy to get at. Who's it for? This determines, and there was a mention earlier about a little bit about scale, which is part of this. Who's it for? For senior policy decisions in public health or other organizations, then we need to know some very simple information, or generally some simple information is sort of, do we look at it or not? Is it an effect or not? The next sort of users of the information are public health policy professionals, mostly policy analysts, who are wanting the outcomes of risk assessments, impact burden of illness assessments and cost-benefit assessments to say, well, how much is it going to cost? Is it worthwhile? Should we be doing something about it? And the last group of users are those who, having had the go-ahead to actually do something about it, we've decided, are those who wanted to put in place public health programs, which is including targeting, surveillance, and interventions, and so on. And the methods that we're using are, broadly speaking, projections, understanding what's happening at a long time scale, and usually perhaps on a national geographic scale, for the future, projections for the future, prediction, what's where and when is it at present, and down to a final level, which is sort of either local level, where is it, or forecasting temporarily, is it going to be a bad week next week? And by and large, as we move down these continuums of users and methods, we're getting to smaller spatial and temporal scales, and we're quite often needing greater complexity in the models, more things to be accounted for. Just in terms of what is the process, by and large, that we use, and people have talked about this, have already shown the results of this before, but just to go over what the process is, we take our knowledge of current potential influences of climate and weather on a vector-borne disease risk. We use a model of some sort to integrate that into an outcome of abundance of vectors, or presence and absence of vectors, or presence-absence of vector-borne diseases, and hopefully accounting at the same time for a whole load of other variables which may be co-varying and that we need to account for other than climate. And out of that, we obtain a quantitative relationship between the climate and the vector-borne disease risk, which hopefully, as I mentioned, accounts for those other variables that are non-climate independent. Then we use either this simple relationship, some algorithm, or perhaps some sort of more complex model, and use climate model output to then produce projected future risk. And that is risk assessment, essentially, for the future. We can also, from that risk assessment, design kind of what we're going to do about it if we decide that we are going to do something about it. But also we can use the same relationships to using current weather data, again with models, algorithms, and so on, to produce these adaptation tools like forecasting for West Nile risk in this case. If we want to go in to do all those add-on things, burden of illness and so on, then that's something we can base on that information, but that's another add-on that we have to do. The biology, of course, vector-borne diseases were, I think, the first infectious diseases that anyone thought, well, climate's going to have a big impact on it. Based on the intrinsic susceptibility of vectors and vector-borne diseases to climate, so they were in weather, and they basically had a sort of princess status at the Climate Change and Health Ball at the time. And the temperature affects directly mortality rate. Temperature affects the duration of the life cycle, rates of development from one stage to another. The warmer it is, generally the shorter the life cycle, the more abundant the vectors are. And also rainfall affects breeding sites and the capacity for reproduction. Temperature, they're poikilotherms. Temperature affects activity. The warmer it is, the more active, up to a point, that is. Humidity is important for activity of many vectors. But again, if it's too much rainfall, and then that stops them being active. Complicated relationships in many ways, not simple relationships. And that means that quite often the vectors are going to change in some way, but not in linear ways. Another important variable is the extrinsic incubation period, and that's the incubation period in the mosquito. When a mosquito acquires infection, the bugs are in the gut. Those bugs have to get into the salivary glands for the mosquito to be able to infect somebody having acquired infection. And that it processes itself temperature dependent. The hotter it is, the faster it goes. But of course, temperature is also affecting the mortality rates of the vectors. And you can do an interplay of the two, and that is an important factor in determining where mosquito-borne diseases can occur. Vector-borne zoonoses have a whole other layer of natural complexity. I say natural, I mean non-human complexity. The host communities, reservoir host communities, may be affected directly and indirectly by climate change. Here we have the white-footed mouse looking perky in southern Quebec, and looking perky, quite right, because he's moving more north with climate change. And here's the deer mouse who's looking suitably afraid because he's being extirpated by perky white-footed mouse. So there are a whole load of other effects of climate change on seasonality, demography of processes in the populations, which are going to have impact on where and when vector-borne diseases can occur and their variability in time and space in risk for people. Internationally, vector-borne diseases, the most important ones, of course, are malaria, dengue, chikungunya, by and large, human to vector to human transmitted, so no animal hosts. Climate change may theoretically impact the occurrence of these, the vectors and the pathogens, but practically, historically, climate has had a relatively small role in the variation in the occurrence geographically of these pathogens, because many human-induced activities of habitat alteration, eradication, drainage of swamps, treatments, bednet regimes, etc., have been considered much more important drivers. But I raised the hypothesis that the climate is still going to have, and climate change is still going to have an effect on this because of our capacity, and particularly of developing countries, to control vector-borne diseases. This is, by the way, not a projection. This is a hypothesis, or that with climate change, we're going to get effects on famine. We're going to get effects on resources, particularly hard hit in developing countries. We're going to get greater war, perhaps. And less capacity of the developing countries in particular, and maybe us too, in terms of being able to control and put in place meaningful control. More infected people migrating, more refugee, economic migration, an increased movement of vector-borne diseases, possibly increased abundance around the world, and increased movement elsewhere around the world. Okay, just a word about the methods. First of all, the mathematical and simulation models. These are models that are using true observed relationships, field or lab, between climate and some important attributes of the life cycle of the vectors or the pathogens. So it's taken real hard lab data or field data that is showing, okay, if you increase the temperature by that, then this is what happens to the vector. And hopefully you integrate it with a whole load of other variables as well, and it allows you to synthesize the information. That having been said, it is feasible to do some very simple modeling. In fact, I'm not entirely sure whether I should be putting this in modeling, but we've heard in many cases we have to depend on some very simple laboratory or field obtained indices of the climatic limits for the occurrence of vectors or pathogens. Sometimes we can use simple mathematical models which put a few of these together, But if we want to get down to really accounting for a whole load of variables and getting down to some pretty detailed information, then we need to go to much more complex simulation models. This is a schematic diagram of the Ixodes scapularis Lyme disease vector life cycle. Just as an example, it's not relevant here. But what we're using here, this is a sort of a relatively complex model, I guess. But we're taking real values for development rates. It's parameterized on that, real field and lab observed mortality rates, effects of temperature on development rates, some other variables on host abundance and so on. And by running a simulation with climate in there, we can have some sort of output from this model, which will either directly the abundance of the vector, or if it with a few sort of mathematical sort of twists, actually getting the basic reproductive number value. And we can, with a number of simulations, we can calculate a relationship between the climate variable, in this case we're interested in sort of annual temperatures, and the abundance of the vectors, which might be zero, in other words, presence, absence, and abundance. We have to measure, get an idea of the local of uncertainty through sensitivity analyses. These can be used for pretty much all of the what I discussed previously, those risk assessments, impact assessments, a national, regional scale. We can do, we can use the outputs if they're fine enough to target surveillance interventions, if they're validated. And a number of things that possibly other models can't do, such as dynamically modeling spread and predicting evolution of variants. The pros of these methods are that they use real hard relationships that we found in the lab or in the field. So they're pretty usually unequivocal variables. The cons to using them is that they quite often require a lot of information that we don't have. So we happen to have a lot of information about the Lyme disease vector and a few other vectors, but there's a limit to our knowledge there. The data may just well not be available to make a meaningful model. There's a conflict between precision and parameterization. The more precision we want, the more parameters we want, the better we want to be biologically correct in modeling the mosquito or the tick or whatever it is. But the more parameters we've got in, the more we've got the chance of going wrong, and therefore we might just end up going down the wrong way. And we need to use prospective studies for validation. There's nothing intrinsic in the data we're using here that allows it to be validated. The pattern matching approaches, these I guess we use, and a lot of people use because they're very good at the techniques, but we use them generally because we don't have the knowledge of to create a simulation model. And we're seeking associations between variables, particularly environmental variables such as climate, and the occurrence and abundance of the vectors, pathogens, and so on. There's a range of models, of course. Presence, absence, we're using regression models of some sort. Presence-only data, there are a number of methods available, machine learning, neural networks, Maxent, GARP, BioClim, and so on and so forth. We're frequently using the geographic information systems, Ben, and information from remote sensing and so on that Ben was mentioning this morning. We have a geo-referenced location value, and for that point, by geolayers in a GIS, we can associate that with a whole load of climatic and other environmental variables from ground level remote sense data. And with presence, absence data, we can then build a statistical model from which we can quantify the climate or weather vector-borne disease risk relationship. Of course, the uncertainty is essentially expressed in the outcome from the models. And we can use them for exactly the same things as the mathematical simulation models, perhaps with the exception of dynamically simulating spread and evolutionary processes. The pros to these presence-absence data, or at least presence data, are usually readily available. The explanatory variables are quite often readily available from remote sense data and from just at your desktop. You don't really have to get out from behind it frequently. And the presence-absence data can be used for validation. Again, so you can do some validation at your desktop without actually having to do anything prospective. The cons are, of course, statistical type 1 and type 2 errors, that you're missing environmental drivers, or you're identifying spurious associations. And there are a number of ways that you can identify spurious associations, apart from having false positive data, which frequently, if you're dealing with kind of human case data, and there was some mention today earlier on about that there are some issues with a lot of the presence data in vector-borne disease, but particularly with false negative data, that the realized niche where you find the vectors is not actually their climatological niche. This, for example, with the maps of malaria, where you're finding malaria is both the climatological niche, or climatological factors, but also the effect of control efforts. So there are a whole load of conflicting values in that process. And also, the vector's range is affected by other environmental factors. And here, if you look at these maps from that George showed earlier with the spread of the human cases, in this case of Lyme disease, if you were to do some sort of climate model on that, you might get a very different relationship, or somewhat different relationship, that if you were to do presence-absence data using these data in sort of 12 years later. And that's just down to the spread of the tick. It's not down to the fact that the climate has changed. It's just that during that time, the ticks have been spreading and filling the space available. Here's a couple of examples. This is chikungunya. Of course, it's suddenly become a concern for us because there's an epidemic going on in the Caribbean. And we're now getting suddenly a lot of people coming back to Canada with chikungunya, and many of them are viremic too. So if we have vectors that are capable of transmitting it, then we could have autochthonous transmission, which adds a whole load of other public health issues to chikungunya. So we used, in this case, some very simplistic climatic indicators for the occurrence of the vector: overwintering temperature, minimum January conditions of temperature, and a couple of other simplified three actual combinations of climate and of temperature and rainfall data. We validated against the Aedes albopictus surveillance in the US, which is quasi-presence-absence, but only quasi-presence-absence data. They seem to work pretty well, and there is, of course, when you look at where it is now, there's a little bit of, or the prediction for now is pretty similar amongst most of the methods. There's a bit of variation amongst the models, but actually much of the variation is between the different indicators. So, and this is one of the problems with doing something simplified, is that both of these are pretty simple, but they produce a pretty different outcome. And so we can still use that, but that lovely representation of a map needs some quite complex interpretation. This is vectorial capacity, which is sort of bringing together some of those variables around the life cycle of dengue, particularly the extrinsic incubation period that I was mentioning, looking how that will change with climate change, and it can produce maps which need very careful interpretation, because this says where change is going to occur. It doesn't say where or whether change is going to be big or not. It doesn't tell us whether change is going to bring conditions into a range that is suitable for the survival of the vectors or the pathogens. So there's a potential. That's one of the problems with these relatively simplified models, is that they can over and under predict, and they need careful interpretation. This is what we did with the more complicated model that I showed you before. Even so, we got our sort of modelers get out of jail free card, the assumption. We assumed that there's suitable habitat, but based on field, we had some justification for this field study, suitable host densities, and that we've got these ticks coming from the US being brought in all the time by migratory birds. And then we ran the simulation model for a load of locations in Canada, and from that looked at the relationship between certain temperature, and it was temperature indices, and the capacity of the tick of the vector of Lyme to survive or not. And having got that relationship, you can then map it, as we've already mentioned, and then produce the kind of then apply sort of from this, which is using current climate, and then apply climate model output to produce these kind of assessments for where the tick might be in the future. But then in order to do that sort of burden of illness stuff, you've got to get hold of all those other unclear pieces of information, which is how does that translate into cases. And that is a real, as much of a problem as it is for vector-borne disease as for any other infectious disease. We have validated this, and again, I can't emphasize enough the need for validation. This is prospective validation, both going out into the field and sampling in loads of areas and seeing if the ticks are turning up in a pattern associated with climate, weather, and similarly using tick surveillance data here on a more national scale rather than a regional scale. And of course, it's happening now. The ticks are moving in. They've read the risk maps. They know where to go. And unfortunately, it's gone from a modeling exercise to a real public health issue. My kids are now doing tick checks when they come back from camp. This is an example of the statistical approach. Presence-absence mosquito surveillance from 2002 onwards in Canada. Looking at where Culex pipiens, the vector of West Nile, might end up. We've got a whole range of environmental variables that we're looking at to see if we can find associations, building a multivariable model, which then we fit the temperature data from global model output and produced projected distributions for the future. And lastly, I would just emphasize the adaptation tool side of modeling, which is the forecasting. This is forecasting West Nile virus risk, just using statistical models. Colleagues at York University have done this. It's very neat. And it's working very well. The observation is the red model. The model output is green. And they're now producing simulation forecasting, which gives about 1 to 2 weeks warning of West Nile risk, because they've got mosquito abundance, but also modeling prevalence as well. So we combine the two to get some kind of estimate of the environmental risk. Again, how that translates into human cases, we've not been able to get to yet, but at least we can base some kind of warning on the basis of this information. So, in summary, there's a range of modeling methods available, and I've separated them out, and there's lots of modeling methods that I haven't included that can include some sort of social aspects like network analysis and what's the word for it? Human modeling, agent modeling, which can get a handle on the sort of the social aspects too, to some extent. But essentially, we cannot use these to elucidate the climate vector-borne disease relationships, and on that we can then develop projections for the future and adaptation tools such as forecasting using weather data. All of them have their pros and cons, and our confidence absolutely depends on validation, which is frequently not done, unfortunately. Gaps and needs, from my perspective, just to fuel a bit of this debate, I guess, is the data and knowledge of the life cycles. In order to be able to produce meaningful simulation models, then you need to have the lab and field information in order to be able to reproduce at least the key components of that in some kind of useful simulation model. We need systematic surveillance. We really don't do surveillance in a systematic way, both in time and space. And without that, you can't really do. It's always going to be something that we're missing in terms of having data to model and also data to validate. We need long-term monitoring in order to calibrate and validate projections and see really what's happening. We need to link climate and vector-borne disease models. I know this has been done in Europe a lot more than here, or for us, should I say. More direct linkage of in a dynamic way, I believe, between climate change, ecological processes, socioeconomic processes, and which are all determinants of vector-borne disease risk, as well as the intrinsic effects on the vectors and the vector-borne diseases. And then lastly, standards for characterizing uncertainty. How do we get around to doing it in the same way for everybody so that different studies can be compared? So that's it. That's me. Thank you.
I'd like to thank Nick in giving us the Public Health Agency from Canada's perspective. I would suggest, because in the interest of time, two things. I will take one question specifically to Nick, and I will ask the earlier session speakers and the panel to start coming up so we can get ready for the panel at the same time. But if folks have a specific question for Nick, I definitely want to hear that.
That's it.
You amaze them. Could I please have the previous session speakers as well as the panel come up, please?